Knock knock, Justin.
Hello.
Hi, Justin. I'm a clinical dietitian here at the hospital. I was coming because the doctor let me know that you were having a little bit of decreased appetite before you came into the hospital and just some early satiety. You weren't really able to eat how you normally were.
Yes.
Is that accurate?
Yeah.
Okay, good. Well, I'm going to ask you more questions about that later, but he just wanted me to do a nutrition-focused physical exam. And that's where we just look over the whole body and we look for nutrition abnormalities, signs of malnutrition. So I'll look at your muscle stores, your fat stores, see if you have any edema. Is that okay if I perform that today?
Yeah, that is.
Okay. And before I get started, do you have any sore spots, tender spots that I should be aware of?
No.
Okay. I won't be digging in too deep, but I just want to make sure you don't have anywhere that I need to be aware of. If anything gets too intense at any time, just let me know and we can move on to the next area.
Sounds good.
Okay. Well, normally what I would start off looking at is your vitals, but I saw that the nurse just grabbed those for us, so I was just going to go over those with you. So it looked like she did your blood pressure, which was 111/70, which is really good. We're looking for anything under 120/80. So yours is looking perfect. They also did a pulse rate, and yours was 67. So anything normal would be between 60 to 100. So good there too. And then they also did your respiratory rate. So that's counted per minute, beats per minute, and yours was 17, and normal is 12 to 20. So cardiovascular, everything's looking good there. First, we're gonna do a cranial nerve assessment. So I'm just gonna have you swing your legs over here off the end of the bed. And what we're looking for here is just to make sure all your nerves are functioning properly. If I see anything that needs further evaluation, then we can look further into it, but we'll just start with the basics. So I'm going to start with your optic nerve, and I'm just going to have you look right over my right shoulder to start, and I'm going to shine a little bright light at your eye. So just look straight up over my shoulder. Okay, your right eye, left eye first. Okay, and then I'm going to look over this side. Okay. Perfect. Okay, and then next I'm just going to have you look right into my eyes. And then I'm going to check again just for pupillary responses to this stimulant. So we'll just have you look straight at my eyes. Perfect. Okay. Perfect. Looks good. I can see them retracting when they see that light. So that is exactly what we're looking for. Okay, so next I'm just going to have you follow my finger with your eyes. And while I'm moving it, just try not to move your head at all, but just your eyes. And this is looking at your cranial nerves 3, 4, and 6. So okay, perfect. That looks good. So next I'm just going to feel right here on your jaw, and I'm just going to have you clench down. Let me do that one more time. Just going to palpate around, make sure I can feel everything in there, and that feels great. So next I'm just going to assess your facial nerves. So I'll start by having you do a big smile, and then I'll have you open your mouth. And I'm just gonna look in here really quick. Can you say ah?
Ah.
Can you one more time?
Ah.
Perfect. Okay. Looks good. And then I'll have you stick out your tongue. And then can you move it side to side? One more. Good. Okay. Looks good. And then I'll have you shrug your shoulders. Okay. Perfect. And then raise your eyebrows. Perfect. Okay. Looks good. And now what I'm going to do is just assess some of the other nerves. So I'm going to put my hand here and I'll just have you push your head against it. Perfect. And then I'm going to do the same on this side. Looks good. Okay. So it looks like your cranial nerve 8 is fully intact because you're able to follow my instructions really well. So I don't think we have found anything that looks like it needs any further assessment. So we are good to move on.
Perfect.
And the other thing I forgot to mention before we move on is just what I was looking for inside your mouth was any signs of vitamin deficiencies. We look for swelling, any inflammation. We look at the color of your lips to make sure there's oxygen flowing through there. See if you have any pore dentation or inflammation in your gums. Just make sure you're able to chew and everything. Okay, so just so you know, inside your mouth, that's what I was looking at.
Gotcha.
We call this a dysphagia screen, and we're just looking to make sure your esophagus, everything is working properly. So to start, I'll just have you do a nice loud cough. Okay. And everything sounded normal there. I didn't hear any like phlegm or any signs that there was anything stuck in there. How did it feel?
Oh, good.
Oh, good. Okay.
Yeah.
Okay. Perfect. So next, what I'll do is I'm just going to have you drink a little bit of water. So this is 3 ounces of water, a little bit less than half a cup. So when you drink this, I'll have you do it continually. So try not to stop or take sips of it. And as you're drinking it, I'm just going to put my fingers right here on your throat, and I'm just going to feel for when you're swallowing.
Okay.
And then if you could say hello.
Hello?
Okay. How did that feel?
No.
Okay. Does it feel like there's anything stuck in there or like irritating or phlegmy?
No.
Okay. Okay. Good. So now we're just going to sit here for about a minute, make sure nothing comes up during that minute. You don't have any coughing, regurgitation, choking, or any like gurgling sounds that come up. Okay, perfect. It's been a minute and you have not had any gurgling or signs of aspiration, so I don't see any need to further examine your swallowing. How are you doing so far?
Good.
You good to continue?
Yeah.
Okay, perfect. So this next part, we're just going to be looking at your fat and muscle stores. We're also going to be looking for any signs of swelling, edema in the body, and just check your hydration status. Okay. So I'm just going to start at the very top. I'm going to look at your hair. So what I'm looking for is just any broke or damaged pieces, any dullness, any dry flakiness coming, but your hair looks really good. Those can be signs of vitamin deficiencies, but I don't see any concerns with yours. So next I'm just going to move on and look at the fat pads. These are called your orbital fat pads. It's just right under your eyes. So I'm just going to feel kind of around very gently right here. Does this hurt at all?
No.
Okay, good. So what I'm looking for is when I palpate this is just that the skin bounces back nicely. It shows me that you have a healthy amount of fat still in there. So no concerns there. Sometimes what can happen is if we're not getting proper nutrition, those can start to waste away. So it gets hollow and kind of sunken in, or it might look really dark ring around our eyes. So that's what we're looking for. And then also right next to the eyes, we have our tempora muscle right here. So this is one that we can feel really good when we eat. So I'm gonna kind of feel this, and then I'll have you bite down like you're gonna take a bite of food.
Okay.
Do that one more time. Okay, perfect. Yep. And so when you bite down, I can feel that flexing. So that lets me know that you have not had any muscle loss there.
Gotcha.
Perfect. And so the next thing I'm going to look for is just your throat. I want to look right just to feel around for any lumps or bumps that might be present. One deficiency that can happen is iodine deficiency, and what we look for is just what's called goiters. They're just little bumps or lumps that can happen in the neck. Yours feels really good though. Have you ever noticed any irritation or things that feel a little abnormal?
No.
Okay, perfect. Well, yours looks good. So then we'll just move on. So going a little bit further down the body, I'm gonna just pull your gown here a little bit to the side and look at your clavicle. So yours looks really good. I can see the outline of your bone, but it's not protruding in an unnatural way. I can't fit my fingers under it, but I can see it nicely. So that tells me that you have not had any loss there. And then one of the other things we look at here is your acromion process, which is just where that bone meets your shoulder. What can happen is when we're not getting proper nutrition, again, we just see a lot of protruding of that bone. So instead of having this nice round appearance like your shoulders do, it's more about square because there's no padding here on these sides. So yours looks really good. So I don't have any concerns there.
What?
And then next we can look at your, let's see, what do we want to do next? Are you able to move forward okay?
Yeah.
Okay, so I'll just have you lean forward a little bit, and I'm just going to check here on the back side, looking at your scapula, your deltoids. They look very healthy, good stores. I don't see, again, anything protruding out as I palpate around. So that's perfect. Okay, good. And then yeah, you can lean back. The next thing I'll look at is your tricep. So I'm just gonna have you hold your hand up like this, and if you can put it just in front of you.
Yeah.
I'm gonna just gently pinch this skin right here. And what I'm looking at is these fat stores under here.
Okay.
If you were to have skin where I could actually feel my fingers touching each other when I pinch, that would be a sign of fat loss here. We all have natural fat that happens right here under our tricep, which is healthy, and yours looks perfect. So next, I'm just gonna look at your hands, and the first thing I'm gonna look at, I'll have you do just a okay, perfect, like that, and I'm gonna feel here, this is your inner osseous. We actually have a little tiny muscle in there that a lot of times can start to break down, again, if we're not getting proper nutrition. But yours feels good. I can feel it in there. I'll feel it on this side as well. Okay, perfect. Yeah, I can feel that in there. And then while I'm on your hands, I'm just gonna take kind of a general look at your skin and your nails. Sometimes what can happen is if we have iron deficiencies, our nails can actually change shape. They get kind of that, like, it looks almost like a spoon shape. It's really, really round. And that can be a sign of iron deficiency. Sometimes the nails can get really dry and brittle, or the skin can get flaky. Those can be signs of hydration issues, vitamin or protein store issues. So it just means you're not getting quite enough for some reason. But yours look really good, so I don't have any concerns there. Perfect, you can put those down. And then the last part I want to look at is just your lower extremity, your legs, if that's okay.
Yeah.
So you can just have that straight out. If you actually, instead of straight out, could you put your foot up on the bed like that? And I'm not going to pull this all the way back, just a little bit. So what we're looking for here is just this healthy line between muscle and fat tissue, and you can see yours is very prominent, so you can tell that your quad muscle is still very intact, so that's perfect. So next I'm just going to look at your patellar region on your knees here. Again, we are looking for a lot of extra bone protrusion, but you can see here you have very soft tissue that bounces back. When I push on it, it doesn't stay sunken. It comes right back, which is good. We know that's healthy tissue and not signs of swelling or edema. And your kneecap looks just how it should. And then if you could put those knees, yeah, perfect, just like that. I'm gonna look at your muscle stores and your calf muscle. So what we're looking for is we just want to have symmetry symmetry in both legs. We don't want to see a lot of difference in the size or the circumference of them. So I'm just gonna feel, and I'll have you flex that if you can. Perfect. I'll feel this one. That's good. Yeah, you still have lots of muscle in there, so I don't see any signs of wasting. There's no extra skin, so that looks good.
Yep.
And then I'm gonna have to take one of your socks off, so I will just take this one off, and just feel around for edema. So that's just swelling that can happen. It's most common when it occurs is in our lower extremities, and so I'm just gonna feel around. This feels good. Does any of this hurt at all, or have you noticed your socks fitting tighter or hard time getting your pants on at all?
Nope.
Okay. Yeah, that looks really good. None in your ankle, none in your legs. So I think I'll check this one too just to make sure, but yeah, they look the same size And again, that skin comes right back when I push down on it. Next, we're just gonna look at your pulmonary function. So I'm gonna start on your back, and what I'm gonna be doing is just palpating the back of your chest wall, and what I'm looking for is vibrations that come actually off of your lungs, and so it's just letting us know that those vibrations are still there and healthy, and there's nothing that is blocking them. So I'll start up kind of at the top, and I'm gonna move my hands down your back, and I'll just have you say the phrase 99 each time I move, and I'm just again gonna be feeling for those vibrations that are moving through there.
Gotcha. 99, 99, 99, 99, 99.
Okay, perfect. And then I'll have you switch to the front, and we're gonna do the same thing. So I'll just again have my hand in a V shape, and we'll start right here.
99, 99, 99, 99, 99.
Okay, feels great. Yeah, I don't hear or feel any blockage or anything in there. If I were to feel anything abnormal, then I would use my stethoscope to do a little bit further of an evaluation and just listen for any like cracking or rows or stridor, which are just different noises that we can hear when there's something obstructing the lungs that shouldn't be there. But you sound great, so we're just going to end our pulmonary assessment there.
Perfect.
Next, we're going to do the cardiac assessment of this physical exam, and so I'm going to be looking at your second right intercostal, your second left intercostal, and then your left sternal apex. So it'll be here, here, and down here. So I'm just going to start with this right-sided one. I'll move over here to the left, and then down here to that sternal border apex. Okay, and any tenderness while I was palpating that, stiffness?
Nope.
Okay, and I didn't notice any hollowing or anything like that, and so that just lets me know that the blood is flowing really well, so I don't have any concerns there.
Yep.
And then one of the other things that I've been looking at as we've been going along that I was just kind of doing visually was just looking at your sternum, just to look for any sternal depression. Also was looking for what we call kyphosis, which is just, or kyphosis, which is just kind of that rounding of the back. But those both looked really great. I could kind of see it a lot better, the back side, at least when you were standing up, and I didn't see any signs of that either. So I think no concerns there either. So next we'll just move on to the last portion of our assessment, which is just an abdominal exam. So for that, I'm going to have you lay flat. Now that you're laying down, is this a comfortable position for you?
Yep.
Okay, so this will be the final portion of our physical exam. What I'm going to be doing is just examining your abdominal area. So I'm just going to lift this up. I apologize if my hands are cold. They are always cold. And what I'm going to be doing is just feeling around in your 4 quadrants. We have our upper right, our lower right, our upper left, and our lower left. So I'm just going to be feeling around for any pain, tenderness, distension. There is, some pulsations, movements that's going through there, and that is very typical. That can happen when we breathe. You can see your stomach going up and down, from your heart pumping blood how it should, or even sometimes as we're digesting food down our digestive tract and it gets into that large and small colon, we can see some movement in there. So that is all completely normal. But I will just go ahead and start here in your upper right quadrant and kind of palpate around. Do you feel anything while I'm moving around here?
Nope.
Okay, what I'm looking at here is just feeling around for your liver, and then right behind our liver is our gallbladder. So I don't feel any distension or tightness there. So I'll just move down here to your lower right quadrant. As I'm pushing there, anything?
No.
Tightness? No. Okay. This is where our appendix is and part of the large intestine. So good. And then let's move up here. I'm just going to feel kind of under your rib cage. This is where our spleen can be. If there's any inflammation or issues with the spleen, sometimes we can feel part of it. I don't feel anything here. Do you feel? No pain or tightness or anything?
Nope.
Great. Okay. So then down here, or lower left, when I push palpate there, this is looking at your large colon. looking for any distension again or tightness?
Nope.
Nothing there? Okay, perfect. Well, I'll go ahead and put that back down. Okay, well, Justin, that concludes our physical exam. Do you have any questions for me?
No.
Okay. Well, what I'm going to do is I will let the doctor know that everything looked good on our end, and then we will just go from there.
Perfect.